So we've already announced you, but just to briefly introduce you, I mean, I do want you to introduce yourself. I'm just going to be telling everybody. So you're here because basically we have started collaborating when we announced the GCPR, and we wanted everybody to be on board with us so that we can co-create the policy database. And you have already presented to us a spotlight on Singapore and what has been going on with all the policies and how the government has reacted with regard to the tracking application. And a lot has changed, I think, since we last spoke. So this time you'll be leading us through the leveraging technology as a public health policy tool, and especially with focus on the Singapore approach to addressing the COVID-19. I am very eager to hear what has changed since last time we spoke. But yeah, please, the stage is all yours.
Yes, thanks so much, Anja, and thanks everyone for sticking around. So really, I'm privileged to be here to share more about the Singapore perspective. So my presentation is basically sort of an extension of what I shared the last time during the spotlight session, with just a few recent developments. And I think the situation is so dynamic that even just a few hours back, there were new announcements coming in about, the possibility that, we're going to move to phase 3. Which is a further opening up, which, is a really positive sign. So that's something that, we're all looking forward to. So yeah, I'm happy to share more, and maybe I'll start with just sharing the slides that I prepared, and I'll just run through those. And okay, I don't think I have the share screen enabled yet. So maybe if I could.
Absolutely. Well, can we make Nisha a co-host?
Okay, great. Thanks so much. Okay, so as Anja mentioned, the focus of my presentation is really about, how Singapore has actually utilized technology. It's a very technology-centric approach to addressing, I think, one of the most, pressing public health crises that we have seen in recent times. So I'm just going to run through, how exactly technology has been leveraged, what has the responses been like, what are some of the legal/policy concerns that have emerged from utilizing these so-called tracking tools, or what they would call digital surveillance tools. And I'm more than happy to take questions. And I think the idea for me is also to learn more from colleagues and peers across other jurisdictions, what the approach has been like in your own countries with dealing with these types of surveillance technologies. So I'll run through my slides as quickly as I can, because the idea is to really get to open the floor for more discussion. So this was actually at the start of when the circuit breaker was announced in Singapore, and our Prime Minister, during his address to the nation, actually mentioned that one of the approaches to tackling this crisis was basically making full use of IT, information technology, to help us do more efficient tracing. And I think the idea was that at this point, given how rapidly the virus was spreading within communities, contact tracing was something that was really emphasized a great deal. And, behind the scenes, at the governmental level, there was so much of work going on to make sure that we came up with, appropriate tools that we could actually use, technology-driven tools to help facilitate the contact tracing process. So what exactly did Singapore come up with in this case? So the most major one that came out was actually what we call the Trace Together application or app. And the idea of Trace Together is that, it adopts a very community-driven approach to combating a community spread of COVID-19 within Singapore. So basically, it operates on a Bluetooth-based technology. So you have to install this app on your smartphones or mobile phones. And when you're, let's say, you're out in public and there's another user who also has downloaded this app, it will send Bluetooth signals to those who are actually within the proximity. And of course, the information is anonymized, but it's actually stored on the phone such that if one of the users that you were in close proximity with, unfortunately tests positive for COVID, you'll actually be contacted by officers from the Ministry of Health, and you'll be asked to, to quarantine or self-isolate for a certain number of days to go through the testing to make sure that, you're not out in the community unawares and unknowingly carrying the virus and, unwittingly spreading it to other members of the public. So this app was announced, and, they mentioned that, it's really to complement the contact tracing process, because at the height of the pandemic here in Singapore, when, you know, cases were really going up, we also had manual contact tracing. So we had volunteers, we had people from the public sector, private sector coming in, stepping in to help do manual contact tracing. And by manual, I mean, this literally means people sitting in front of computers, calling each and every person in the contact list, you know, just checking like on this date, on this particular time, were you at this location? How long were you there? How many people were you with? You know, things like that. So it's also a very time-consuming process. And the idea of having an application like this was really to just speed up and make the process more efficient. So like, I think a commonality in a lot of Singapore's policy approach is that it's very much community-centric. So whenever, you know, they come up with a tool like this, there's always this emphasis that you're doing it not so much for your benefit, but to benefit others, to benefit your loved ones, to benefit your community. So I think something interesting to take note of is the language that's used. I think a lot of times in policy communication, you know, we might be quick to dismiss or disregard the language element when it comes to actually, you know, promoting or publicizing tools like this. But so this sort of diagram graphic was taken from the Trace Together website. So you'll see that, you know, there's three sort of pillars. So the first is, of course, protecting yourself. If you are exposed to, you know, someone who has tested positive, then, you know, using this app means that you can be, you know, contacted easily, and you can take necessary precautions to protect yourself. Then, of course, you have protecting your loved ones, so your family members, and protecting your community. So again, the language here is very much community-centric, and I think it reinforces the fact that when Trace Together was actually you know, put out there, it was, you know, it emphasized a very community-driven approach. So that's something that, you know, I thought was interesting to highlight. So how do you actually download Trace Together? So you can download it as a mobile application. And yeah, so it's, you know, for both, you know, Apple iPhone users and Android users. So everyone, you know, all bases are covered more or less. And so I think in about June or July, there was actually talks about having a physical token. So what happened was, initially when the app was rolled out, the number of downloads was actually still quite low. So the authorities were wondering, you know, why is the take-up rate still low? Because at the time, it wasn't mandatory. You know, it was just seen as more like a doing good for the community thing if you were to download the app and, you know, enable your Bluetooth so that, you know, you could facilitate contact tracing. So I think they realized that, you know, not many people might actually own a smartphone, and especially when you're talking about senior citizens who might not know how to actually download an application, you know, scan a QR code, things like that. So they actually introduced a physical token. So this is actually available to all Singaporeans, completely free of charge, and it's actually very, very small. So it's really just like, you know, it fits in the palm of your hand. It's super small. You can just carry it wherever you go, and it operates on the same technology that is also Bluetooth based. So if you happen to be in the proximity of someone who has downloaded the app or also carries a token, that exchange of data via Bluetooth still takes place. So, you know, it's really just catering, making sure that, you know, this is a nationwide thing, that, you know, everyone is covered. Everyone has either a physical token or they have the application installed on their phones to really drive, to really help with the contact tracing process. So as mentioned, the tokens is a relatively recent thing. And so once you collect it, it's going to be activated and registered to the user, and no further action is required. So again, like I mentioned, it only captures proximity data. So when the authorities actually said they were going to introduce the physical tokens, and I'll run through this in the later part of my slides, there was actually quite a bit of concern from members of the public that, you know, this is like a tracking device. Are they going to, you know, capture GPS or geolocation data? But what was emphasized is that, you know, it's really just Bluetooth, it's really just proximity data. There's no internet or cellular connectivity. And, you know, at the end of the day, you would still have to consent to, you know, your data being used to help in the contact tracing process. And what they kept stressing was that any data or information collected is strictly in the domain of, you know, Ministry of Health or authorized public personnel. So, you know, these are people who are really, you know, facilitating the contact tracing process. It's not just going to be shared, you know, indiscriminately, and, you know, your data is going to be compromised. So, you know, that assurance had to be given to the public as well. And like I mentioned, it's distributed for free, available for anyone to use. And as of early October, more than 100,000 tokens have actually been collected across the country. So I think we do see that, it's relatively quite well received. And, if you add that on to, the number of people who are using the application, I think that really boosts the efficiency of the whole contact tracing process. So Safe Entry, this is actually sort of like a national digital a system where, it logs in your, so what we call here would be our identity card numbers, so our nationally registered identity card numbers, and mobile numbers of people who are visiting public places. So at the time when it was first set out, it was basically, during the circuit breaker period, we were only permitted to visit places with essential services, so supermarkets. These were the primarily places, providing essential services. So before you entered a supermarket, you actually had to use your mobile phone to scan this code. So there'll be, like a board in front of the entrance of the supermarket saying you have to scan for entry. So, you just put your phone over it, you scan it, and then you have to key in your details, and that logs in. And so they know that, on this date at this time, you are in this location. So it's like a check-in, check-out system, like, in hotels when you check in and check out. So the same thing. So if, let's say, I'm visiting a supermarket at maybe 5 p.m. On a Sunday. So, I will check in, and then, I'll get my groceries, I leave. And then when I leave, I have to check out. So if, let's say, I left the supermarket at 5:30, then it shows that, I left at 5:30, I checked out. So within that 30-minute duration while I was in the supermarket, and if, let's say, there was another shopper in close proximity with me who happened to, be carrying the virus or subsequently tested positive for COVID-19, then they would actually use this data to identify who was there during that period of time. And then they will contact you, identify you, and say that, okay, look, you were in this close proximity to this person who tested positive. We'll need you to serve, to self-isolate, to monitor any symptoms, and, go see a doctor if you start noticing any symptoms arising. So this was implemented early on. And now Safe Entry has actually been integrated together with Trace Together. So I'm not sure if that's confusing, but this is, how technology-driven, Singapore is with the whole contact tracing thing. So rather than having it separate, the Trace Together application now integrates Safe Entry. So all you need to do is, you just open a single application, and you can keep your Bluetooth running at the same time as you can use that same app to scan and to do your check-ins and check-outs when you visit any public place. So right now, currently, any public place that you go, so shopping malls, even schools, workplaces, you have to use this Safe Entry. So you have to actually check in, check out. And if you're visiting food places or supermarkets, there will actually be staff on hand to take your temperature. So they'll so it's a two-step thing. So you have to check in and check out, doing Safe Entry, and at the same time you also have to have your temperature checked. So if your temperature exceeds, let's say, 37.5 degrees, you will not be allowed to enter the premises. So they are quite strict about that. And there have been a number of food and beverage establishments that have been actually sanctioned for, they have received fines for not actually taking the temperature of their patrons and customers. So you can tell that here in Singapore, they are very strict about this contact tracing and Safe Entry. I think, like, again, it's the idea that they keep stressing is everyone has a part to play. So if everyone just checks in, checks out, they only visit places if they're feeling well, you're just helping to reduce the number of cases and helping the country go back to normal as much as possible. So this is the Safe Entry platform. And yeah, so this is how Safe Entry works. So this is on the slightly older interface, but what you do is, let's say you're visiting this location, you scan the QR code. So if you're entering the building, you would click check-in, and then the middle screen shows the details that you need to fill in. So your name, your identity card number or your passport number, and your mobile number. And then when you're checked in, it will show this green pass that says, okay, you're cleared to enter. And the same thing when you check out. So when you leave a place, of course, you don't have to fill in your details like in the second screen again, but you just click checkout and you're taken as checkout. So it's quite, you know, an ingenious system. And yeah, I think it's quite a unique feature as well that, you know, is really empowering the people themselves to take ownership, take responsibility for, you know, helping the contact tracing efforts. So recent developments, so just yesterday actually, so like I mentioned, you know, the situation is always so dynamic, you know, new things come up all the time. So just yesterday, they announced that, you know, checking in with the Trace Together app or token will now be compulsory for people who are going to visit the cinemas. So this measure is going to be rolled out progressively at cinema halls from October 26th. So yeah, next week, actually, sorry, this coming weekend. So cinemas will be one of the first venues to introduce this. And just an hour back, actually, just an hour back before this my presentation, the news actually said that it was going to be compulsory now for all public venues because, like I mentioned, we're actually looking to move into phase 3. So, you know, gradually relaxing some of the restrictions, you know, increasing the number of visitors that we can have to our homes, you know, things like that. So, you know, it's a positive sign. It shows that, you know, these efforts have actually been working. You know, it has not been in vain. You know, it's really the community coming together and really propelling this forward. But of course, you know, not wanting to be complacent, you know, the government has decided to mandate using this Trace Together application for not just cinemas, but eventually hotels, F&B outlets, gyms, and certain workplaces. And what the authorities have highlighted is that, you know, such settings actually have the potential to spark off large outbreaks. I think, you know, in confined settings like this, especially in a workplace, for example, you know, cases can actually spread quite rapidly. I think we saw that early on at the height of the pandemic. So using this app, mandating the use of this app will really just stem the spread. And the idea is that, you know, we don't want to go back to that same situation we were in, you know, just a few months ago. I think, you know, it was really a concerted effort that everyone had to play to, you know, push things along to get to where we are right now, you know, moving on to phase 3. So this was actually the recent development. And like I mentioned, just 1 hour back, you know, even before I could update my slides, the news put that, you know, we are likely to move to phase 3 and, you know, Trace Together is going to be mandatory for entering any public space in Singapore going forward. So, of course, you know, they cite public health concerns, but at the same time, you know, these so-called digital surveillance tools have also raised some data and privacy concerns as well. So I'll touch on these, just flagging some of the issues that have come up. So I've just selected some articles here that actually talked about this contact tracing. So for example, there's this one article that mentioned that, you know, Singapore's contact tracing app actually topped a privacy study. So it was considered to be the least intrusive in terms of privacy communications compared to other apps in the region. And at the same time, you know, you have the authorities coming and saying that, you know, the contact tracing device is not an electronic tag. It's not going to, you know, track your location. You know, it's just basically proximity-based tagging. So, you know, I thought it was interesting to get like these kind of diverse views on, you know, how people have actually viewed it from the privacy angle. So here, our Minister for Foreign Affairs, and is also the Minister in charge for our Smart City initiative. And he actually had to come out and say, you know, this was actually in a Facebook post after he actually spoke in Parliament. He actually reiterated that, you know, this Trace Together token, so the token that I mentioned earlier in my presentation, is not a tracking device. So he was very adamant in making it clear that, you know, it's not a tracking device. It doesn't track location. It's not a GPS. It's really just proximity data, Bluetooth based. And, you know, the data is erased after 25 days. So nothing leaves the device unless you are infected. Then, you know, the data is actually given to authorized contact tracers. And these are primarily from the Ministry of Health. And really, if we have to use the data, it's because, you know, it's really to protect you, to protect your loved ones, to protect your community. So that point kept coming across as well. So this was in June when, you know, they announced that they were planning to release the token, and that caused quite a stir amongst members of the public. So This is actually the privacy safeguards from the Trace Together website. So if you do just a search and you go onto the Trace Together site, these are so-called the 4 principles that they are set out to show that, you know, we really value your privacy. So the first things first, that, you know, it's not a GPS-based system, you know, your geolocation data is not collected. The Bluetooth data is stored locally, and it's only going to be accessed unless you test positive and you're in proximity to other people and there's a need to actually notify them. So your personal information is not revealed to other users. So it's actually substituted by a random permanent ID. So it's all randomized, and only if you need to be contacted, then they will actually identify you and contact you to go through the whole contact tracing process. So they are very mindful of, you know, ensuring that, you know, we're not just collecting your data, your private information, your personal details, just because, but it's only if and when you do test positive for COVID-19, that's when the whole contact tracing process gets triggered. If not, you know, you're just doing your part, you're just keeping the community safe. You know, that's the common assurance. And what they mentioned lastly is that, you know, once, you know, there's no need to actually do contact tracing, they will disable the application. So basically they will just prompt you. So you'll get an alert on your phone saying that, you know, contact tracing has ceased, you know, we're no longer in the crisis period, there's no more cases, you can disable the app. And so once you disable it, you know, that's it, you know, the data is gone, everything is more or less, you know, disappears. So yeah, so these were the privacy safeguards that, you know, they have mentioned, and they have continued to stress this point as well. And so, so this is the, you know, legal policy dilemma that comes up, you know, personal privacy versus public health. You know, I think as Anja and Margaret mentioned early on, you know, we are kind of negotiating a new normal. So does it mean that we also rethink, you know, the premium we place on certain rights or liberties? Like, you know, are we willing to forego maybe personal privacy concerns in the interest of, you know, safeguarding public health? And for a pandemic like this, where, you know, the virus just spreads rapidly, there's no knowing, you know, who could be carrying it, you could be asymptomatic. You know, are we really going to hold on so tightly to our privacy considerations when there's greater public health concerns at stake? So, you know, the existence of data privacy issues has been acknowledged. So our Prime Minister actually commented at the national address in, you know, earlier in April, that there will be privacy concerns, but then again, you know, it has to be weighed. So, you know, competing considerations, privacy versus public health, you know, which do you give primacy in the time of a pandemic? Are you willing to forego certain rights or liberties, you know, for the greater good? You know, do we even consider this? Can we even fit in the utilitarian argument here? And so the majority of Singaporeans, so they actually did a poll, and, you know, quite a substantial majority agreed that, you know, the app should be compulsory. You know, but there was still a low take-up rate. So when they actually tried to identify further what were the reasons for the low take-up rate, I think Singaporeans, being, you know, very pragmatic, one of their main reasons was that, you know, because using the Bluetooth, keeping the Bluetooth on actually slowed down their phones. So for iPhone users, they complained that, you know, every time they had to enable Trace Together, their phones got slowed down, so they couldn't use the other applications. So that was the pragmatic point of view coming in. Some also cited privacy concerns, of course, but, you know, so it was really different reactions, although the general consensus was that, you know, such an app is, you know, a value add, it is useful. So like I mentioned initially, when this was right at the heart of the pandemic itself, you know, in April, May, where cases was really going up, the initial take-up rate was quite low. And one of the biggest complaints was actually that it was inconvenient, it was draining battery life. So again, you know, these concerns. And then there was some respondents who felt that, you know, they were mindful of privacy considerations. They felt that, you know, something like this is equivalent to the government tracing their movements. So, you know, we have different concerns, pragmatic concerns, like, you know, inconvenience of using the app versus privacy. So how do you weigh that against, you know, the broader public health concern at play, right? So yeah, this was just something that I thought was quite interesting, you know, getting the public's perception on the application itself. So I'll just run through quickly some other tools and applications before concluding this presentation. So The government also introduced a WhatsApp and Telegram chat. So I know earlier on at the closing, we shared the WhatsApp link, for the summit. So something very similar to this, it was a way for the government to actually update people. So you could just click on a join link and you can be part of the WhatsApp chat or the Telegram chat, and you'll receive updates on a regular basis on number of cases, new infections, latest policies and advisories. So it's really just public outreach, their way of actually using technology again to enhance policy communication. So you receive the updates at no cost. So again, it's free to use. So this is an example, screenshots from the WhatsApp chat and from the Telegram chat. So it's quite detailed. It actually breaks down the number of cases, that have been discharged, number of cases in hospital. So just to caveat that this was very early on. So this was in March and April. So of course the numbers now are different, but we still receive updates. Like just now at about midnight, there was this update as well that we got, any number of cases, imported cases, so basically anything that's being done at a policy level, it's conveyed through these WhatsApp or Telegram chats. So it's easy, I think, for most of us smartphone users, it's a good way of just keeping tabs on what's going on, at a glance. Like if I'm commuting to work, I just check my phone, like, okay, this is the situation right now, then, it's just policy communication end of the day, in your phone, in your hands. So that's one thing. And also the stay home notice tracking solutions and leave of absence, these were also web-based and mobile-based. So you'll receive a notice through your mobile phones or through an SMS, and then you can do all your reporting through using your mobile phones. So again, it was just really leveraging technology to help with the process. And this one was also a unique thing that came up quite early on. So it was basically a platform to allow members of the public to search for clinics that they could receive special subsidized rates for visiting a doctor if they were diagnosed with a respiratory illness. So this was also to just kind of contain and make sure that people don't doctor hop or go around visiting different clinics, but really just sticking to certain clinics if they've been diagnosed specifically with a respiratory illness. So if, let's say, it turns out that, they've been infected with COVID-19, then, they can take the relevant precautions and, do any contact tracing from there. So, yeah, so we also had chatbots, virtual assistants. I'll run through this very quickly. I'm mindful of the time. So basically, you could type in a question, a COVID-related question, and you will get a response from the chatbot or what needs to be done. So you could type something like, what is COVID-19? And it will give you like a definition or a response that you can refer to. And we also had sector-specific advisories, so dedicated pages. So we had a single resource page covering different advisories issued by the different ministries. So this is a screenshot of one of the pages, official COVID-19 sources, posters, downloadable resources that you can refer to, and sector-specific advisories. So for example, Ministry of Health, they would, just consolidate all the relevant advisories in a single page. Ministry of Manpower. So advisories that are relevant to that specific sector, these will all be found on a single page. So yeah, this is just a side note on, other ways in which, the policy comms angle was facilitated. So yeah, that's the conclusion of my presentation. If any questions, you can also reach out to me via LinkedIn or by email. Happy to take them, and happy to also take some questions now if we have the time to do so. So thank you.
Thank you so much, Nisha. Before we continue, Rob, are you still with us? Hello, Rob.
Yes, I am.
Hey, there is a couple of people, I think, waiting in the waiting room, so let them in possibly. But yeah, I do have a couple of questions for Nisha just before we move on to our next session, and that is, okay, where to even start? So basically what I was hearing is that the Bluetooth applications are collecting all the data, but are going to be, releasing the GPS data only upon having a confirmation that you tested COVID positive.
Yeah, so again, it's not really GPS, it's Bluetooth proximity. So whoever, you know, and it's only with those who actually have the app installed. So if let's say you and I, we've both installed the app on our phones, or I'm carrying the token and you have the app downloaded, and it just so happens that, you know, we happen to be in this cafe and we're sitting next to each other. But while we're sitting next to each other, our tokens and the application is actually registering the Bluetooth. So it gets the signal from your phone and you will get the signal from my phone. And if let's say either of us, you know, test positive for COVID-19, then, you know, they will actually use that data to identify and say, okay, so, you know, I was there in proximity with you. Maybe, you know, we were near each other for about 30, 40 minutes or so. And that could be sufficient time when, you know, the virus might have spread or I could possibly be infected. So then they will alert me, you know, based on this trace together. And of course, like I mentioned, the safe entry thing. So any place that we enter now, we also need to do a check-in with, you know, our names and our mobile numbers. So based on the proximity data and us checking in, then they'll identify close contacts, and then we'll be informed and they'll say, okay, you need to self-isolate, you need to quarantine, this is what you need to get done.
And a question, because I just really want to understand how this app works. So having that safe space, safe entry app, let's say that I entered 3 places and I tested positive, would that mean that those places are no longer marked safe, and whomever would like to go into those places will also get a notification that this place is no longer marked green?
Yeah, so so that's the thing. So initially when you know, the app first came out and people were wondering like, oh, you know, can I actually visit a place if someone has actually visited it and tested positive? So here again, it's not so much about the proximity, but the amount of time that you also proximate to the person. So what the government has done is, you know, like I mentioned, you know, on the Telegram or WhatsApp chats, what they do is they will actually say that, okay, you know, on this date, these places were actually visited by patients who tested positive for COVID-19. So it's just to inform the public, because they said that rather than just keeping it hush-hush and not letting people know, we'll just let the people know that these are the places visited. But if let's say it's just a transient thing, so if, you know, I'm just walking past a shop that you happen to be in, you know, I didn't interact with you, you know, there isn't cause for me to, you know, get alarmed or anything. But if the person has been in the shop and been in contact with, let's say, stale staff, then everyone in that shop at that point in time that had contact with you, if you had tested positive, they'll be informed. And then what happens is, you know, the shop needs to be disinfected. They will get, you know, a special like cleaning crew to come in to disinfect every surface to make it clean. So, you know, otherwise these areas are complete like no-go zones or hot zones, which is not the case. So even on public transport, so, you know, a patient could be, you know, someone who has tested or who's carrying the infection could be next to you on a train. But because on trains, you know, it's transient contact, it's not prolonged or sustained contact where I'm actually interacting with you. There's a chance that, you know, saliva droplets or something could, you know, pass on to you. So it really varies. So it's not just like transient passing contact. It has to be sustained contact for a certain period of time. But they will alert you, but, you know, they'll always say there's no cause for alarm. You know, just note, you know, if you notice any symptoms, just go and see a doctor early, you know, take care of yourself, you know, just be civic minded, be civic conscious. Yeah.